Hi, this is Dr. Sandra Kramers, and in the time of the corona pandemic, I want to show some people how we do our groceries with a family of 6 kids. So I know Dr. Van Winnum has a great video out there that's lovely for groceries, a small amount of groceries, but I just want to show you, this is for a week for 6 kids. And so our wonderful Peapod delivery guy just delivered it, and we have put it in the garage. We have the door open, and I have a table that I wiped down with Clorox and a bowl. And so what I generally will do is put on some gloves, and we'll just show you how I do this. And people have asked me to do this to show them how we get the groceries ready for a big family. You don't necessarily have to wear a mask or glasses or a hat, but technically this is the sterile technique. I mean, this is what you kind of want to do. And since you can't see what a virus looks like and people are scared, this is kind of the extreme. You know, technically we would be hermetically sealed in a hazmat suit and doing this. I don't think that's necessary. The question is, how long can a virus last on a piece of plastic, for instance? So if the delivery guy happened to have COVID, there's always that potential risk. I don't think it's going to happen, but you just don't know. And there's some concern about that around the world. So here we go. So just stay right there. Let me just show you what we do. And so basically I take this bottle of 70% isopropyl alcohol. I have a spray bottle. I fill it up, take it off, fill it up. Usually have enough for a few deliveries. Pour it in. Usually I'll not the whole way. Put this in, and then we're just gonna go basically bag by bag. So I'm gonna pretend that everything on this side, there's a tiny little green line. I don't know if you can show that there. But that's the non-sterile side, and this is the sterile side. So I'm going to, if I step over on that side, then my foot is non-sterile. So I basically will take a Clorox wipe, and I'll take my spray. And what I start doing is I'll just generally spray all the bags first. So this is kind of haphazard, I know, but it just gives me like an idea that there's some areas here that might be potentially sterile. And then I'll take my bags of like vegetables, I'll put them in here, I'll spray them down, and then when we go into the kitchen, I'll wash off the alcohol. If there is anything like, let's say some meat, I try not to let this bag touch my skin. I'll also put this in my, before I put it in there, I'll usually spray it down. And if I don't feel like I'm spraying it down all the way, 360 degrees, I'll take my alcohol, my Clorox wipe or my Lysol wipe, and basically go like this on each one. So now let's say that this is what I think is completely covered. I'll put it on the sterile table. Well, it's sterile table, it's not sterile, but the relatively clean table. This is what I do. And I go through each bag, and I assume each bag is now contaminated, so I don't touch it again until I'm done with all the bags. Now, as I step over to grab a bag, then one of my feet will not be sterile anymore. So this is how I do it. And we go bag by bag. And so now unloading groceries, as you all know, takes 3 times the time to do it, but we're all being very careful with everything we have because we know that any inhalation of a virus particle is the concern, and we don't want to touch virus and then touch our face. So after I'm done with all of this, the spraying and this cleaning, which is potentially overkill, but you can never be careful when you have a big family. Then I will take off my shoes. I'll take off my shoes. I'll basically put alcohol first. My shoes are just slip on. And then I will wash my hands. I'll wash my hands with alcohol, with a spray, and then I'll put another Clorox wipe on here. Then I'll take off my gloves. I'll usually leave them in the garage where nobody can touch them. And then I'll go inside and then wash my hands again with soap and water before I touch my face. So that's how I do it. I hope this was helpful. Please be kind in your comments, but we have a lot of work to do. Thank you.